Cholera is a severe diarrheal disease. It's caused by the bacterium Vibrio cholera. This bacterium infects the intestine and produces a toxin that leads to watery diarrhea. Cholera spreads primarily through contaminated water and food. The disease remains a significant global health challenge, particularly in areas with poor sanitation and limited access to clean water. The World Health Organization estimates there are 1.3 to 4 million cases of cholera each year. These cases result in an estimated 21,000 to 143,000 deaths worldwide. Cholera is a disease of poverty. It disproportionately affects vulnerable populations in low and middle-income countries. The disease thrives in settings where access to safe water, sanitation, and hygiene is limited. Cholera outbreaks can occur in areas with inadequate sanitation infrastructure. These outbreaks can also happen in the aftermath of natural disasters. Such events often disrupt water and sanitation systems. This disruption increases the risk of cholera transmission. Addressing cholera requires a multi-sectoral approach. We need to focus on prevention, preparedness, and prompt treatment. We also need to address the underlying factors that contribute to its spread. These factors include poverty, lack of access to clean water, and poor sanitation. By working together, we can effectively control cholera and protect global health. Cholera infection can manifest with a wide range of symptoms. Some individuals may be asymptomatic, while others may experience mild to severe symptoms. The incubation period for cholera is typically between 2 hours and 5 days. Understanding the symptoms of cholera is crucial for early detection and treatment. One of the most common symptoms of cholera is profuse watery diarrhea, often described as rice water stools due to its pale and watery appearance. Another common symptom is vomiting, which can further contribute to dehydration. Dehydration is a serious complication of cholera. Severe dehydration can lead to electrolyte imbalances, causing muscle cramps, weakness, and even death if left untreated. Other symptoms of cholera can include thirst, dry mouth, rapid heart rate, low blood pressure, and decreased urine output. If you or someone you know experiences severe diarrhea, vomiting, or other symptoms of cholera, it is essential to seek medical attention immediately. Early diagnosis and prompt treatment are crucial for improving outcomes and reducing the risk of complications. Preventing cholera is essential to protect individuals and communities from this deadly disease. The good news is that cholera is preventable. By adopting simple yet effective measures, we can significantly reduce the risk of transmission. One of the most crucial aspects of cholera prevention is ensuring access to safe drinking water. Water used for drinking, cooking, and washing should be from a safe source, such as treated municipal water supplies or properly disinfected water. If you are unsure about the safety of your water, boil it for at least 1 minute to kill any harmful bacteria. Another important step in cholera prevention is practicing good hygiene. Wash your hands thoroughly with soap and water after using the toilet, before handling food, and after contact with potentially contaminated materials. Proper food handling is also essential to prevent cholera. Cook food thoroughly, especially seafood, and avoid consuming raw or undercooked foods. Store food properly to prevent contamination, and wash fruits and vegetables thoroughly with clean water before eating. By following these simple yet effective prevention measures, we can significantly reduce the burden of cholera and protect ourselves and our communities from this preventable disease. Access to clean water is paramount in preventing cholera. The bacteria responsible for cholera, Vibrio cholera, thrive in contaminated water sources. When people consume water or food contaminated with this bacterium, they are at risk of contracting the disease. Ensuring a safe and reliable water supply is crucial for breaking the chain of transmission. Communities need access to treated water sources, including piped water systems with proper disinfection methods or protected wells and boreholes. In areas where piped water systems are not available, water treatment at the household level becomes essential. Simple methods like boiling water for at least 1 minute, using water filters, or using chlorine tablets can effectively kill Vibrio cholera. Sustainable solutions for clean water require investments in water infrastructure, including improving sanitation facilities to prevent contamination of water sources. By prioritizing access to clean water and sanitation, we can create healthier environments and protect communities from the threat of cholera. Investing in clean water is not just a public health imperative. It is also an investment in economic development and human dignity. Access to clean water is a fundamental human right, and it is essential for improving health outcomes and fostering sustainable development. Hygiene, your first line of defense against cholera. Good hygiene practices are fundamental in preventing the spread of cholera. Vibrio cholerae bacteria can easily spread through fecal-oral transmission. This means that contamination can occur when even tiny amounts of feces from an infected person come into contact with food, water, or surfaces. Hand washing is one of the most effective ways to prevent cholera transmission. Washing hands thoroughly with soap and water after using the toilet, before handling food, and after contact with potentially contaminated materials can significantly reduce the risk of infection. Promoting hand washing education and providing access to hand washing facilities are essential, especially in areas with limited sanitation infrastructure. Proper sanitation is another crucial aspect of cholera prevention. Safe disposal of human waste is vital to prevent contamination of water sources and the environment. Communities need access to toilets or latrines that effectively separate human waste from contact with people. In addition to hand washing and sanitation, maintaining overall cleanliness in the home and community is essential. Proper food handling practices, such as washing fruits and vegetables thoroughly, cooking food thoroughly, and storing food properly, can also help prevent cholera transmission. By embracing good hygiene practices, we can create healthier living environments and reduce the risk of cholera outbreaks. Oral rehydration therapy, a powerful weapon against dehydration. Oral rehydration therapy, ORT, is a simple yet life-saving treatment for cholera. Cholera causes severe diarrhea and vomiting, leading to rapid dehydration. ORT helps replace lost fluids and electrolytes, preventing dehydration and reducing the risk of death. ORT involves administering a solution of clean water, sugar, and salt. This solution can be prepared at home or obtained in prepackaged sachets. The solution is easy to administer orally, even by individuals with no medical training. ORT is highly effective in treating dehydration caused by cholera. It can significantly reduce the need for intravenous fluids and hospitalization. The World Health Organization, WHO, recommends ORT as the first-line treatment for cholera. ORT is a cost-effective and readily available treatment option, making it particularly valuable in resource-limited settings. It is essential to start ORT as soon as possible after the onset of diarrhea to prevent dehydration from progressing to a life-threatening condition. ORT is a powerful tool in combating cholera and reducing cholera-related mortality. Zinc supplements have emerged as a valuable adjunct to oral rehydration therapy, or ORT, in treating cholera. Studies have shown that zinc supplementation can significantly reduce the duration and severity of diarrhea in cholera patients. Zinc plays a crucial role in various bodily functions, including immune function and intestinal health. In cholera, zinc deficiency can exacerbate diarrhea and delay recovery. Supplementing with zinc helps replenish zinc stores in the body, supporting the immune system and promoting intestinal healing. The World Health Organization recommends zinc supplementation in conjunction with ORT for the treatment of cholera in children. The recommended dosage of zinc for cholera treatment is 20 milligrams per day for 10 to 14 days. Zinc supplements are generally safe and well tolerated. They are available in various forms, including tablets, capsules, and syrups. Adding zinc supplements to ORT can enhance the effectiveness of treatment, shorten the duration of illness, and improve outcomes for cholera patients. Antibiotics play a crucial role in cholera treatment by targeting the underlying bacterial infection. While oral rehydration therapy addresses dehydration, antibiotics help eliminate Vibrio cholerae from the intestine, shortening the duration of illness and reducing the severity of symptoms. The choice of antibiotic for cholera treatment depends on local antibiotic susceptibility patterns and the severity of the infection. Commonly used antibiotics for cholera include tetracyclines, fluoroquinolones, and macrolides. Antibiotic treatment is particularly important for individuals with severe cholera, those with weakened immune systems, and pregnant women. Early initiation of antibiotics can reduce the duration of diarrhea, decrease the volume of stools, and shorten the period of Vibrio cholerae shedding, thus reducing the spread of infection. However, the increasing prevalence of antibiotic resistance poses a significant challenge to cholera treatment. It is essential to use antibiotics judiciously and only when necessary to preserve their effectiveness. Surveillance of antibiotic resistance patterns is crucial for guiding appropriate antibiotic choices and ensuring effective treatment. Rapid diagnostic tests, or RDTs, have revolutionized cholera diagnosis, enabling early detection and timely intervention. Traditional laboratory methods for cholera diagnosis can be time-consuming and require specialized equipment and expertise. RDTs, on the other hand, are simple to use, provide results within minutes, and can be deployed in resource-limited settings. These tests detect specific antigens or toxins produced by Vibrio cholera in stool samples. The availability of RDTs has significantly improved cholera surveillance and outbreak response. Early detection of cases allows for prompt initiation of treatment, implementation of control measures, and targeted interventions to prevent further spread. RDTs are particularly valuable in remote areas and during outbreaks, where access to laboratory facilities may be limited. They empower healthcare workers to make rapid and informed decisions, leading to more effective cholera control and reduced morbidity and mortality. Cholera is a preventable and treatable disease. It requires a collective effort to effectively control and eliminate it. Addressing the underlying factors that contribute to cholera transmission is crucial for sustainable solutions. Improving access to safe water and sanitation is paramount. Investing in water infrastructure, promoting hygiene education, and ensuring proper waste disposal are essential steps to break the cycle of transmission. Strengthening healthcare systems is equally important. This includes ensuring access to oral rehydration therapy, zinc supplements, and antibiotics. It also involves training healthcare workers on cholera diagnosis and treatment. Community engagement is key to successful cholera control. Raising awareness about cholera prevention, promoting hygiene practices, and encouraging early treatment-seeking behavior are essential for community-wide protection. Global collaboration is also crucial. Sharing knowledge, resources, and best practices can accelerate progress towards cholera elimination. By working together, we can create a world free from cholera and ensure a healthier and more equitable future for all.